you have to earn the respect of others and by getting results. But that doesn't just come overnight. That comes with perseverance and consistency and effort. And especially if you transport back 32 years ago, the mindset, and even to this day, and it's not the fault, and I want to say this very candidly, and I'm sure you'll agree, I've got a lot of friends that are doctors and surgeons and pharmacists, and it's not their fault. That is not their training. This pill for nil, wait till it's broken, approach to sick care really is the way they've been taught, and it's not their fault. So they're leaning in on the tools that they've been shown.
Hi, everyone, and welcome back to another episode of Wellness at the Speed of Light. I'm Dr. Stefano Sinicropi, your friendly spine surgeon host. Now, on today's show, I had the absolute privilege of interviewing Margaret Duffy Wallace, who is an absolute pioneer in the world of holistic wellness. She earned a degree at the University of Waterloo, is a registered massage therapist with a background in kinesiology. She earned the designation as a professional as consultant in aging. She's a visionary behind the inaugural Preventative Health Awareness Month, known as FAM, which is a movement recognized by Health Canada in 2023, which was no small feat. She came on my radar as we are so aligned with the need and the thinking that we need to come together between holistic practices and traditional medical practices to give people the best options to become, as she coins it, CEOs of their own health care. She is an award-winning clinic owner, having founded Wallace for Wellness, which ran for 20 plus years and had tens of thousands of patients under its umbrella before she sold that a couple of years ago. She has a tremendous ability to connect with her audience, has helped many, many brands get their messages out, has been a media personality in Canada, and we are so excited that she made the decision to appear on the show because it could not be more important than in today's world where the chronic health crisis is completely out of control. To have somebody like Margaret come on the show, talk about how she was able to merge the two worlds, how she was able to have so many physicians refer patients into her offices for things they might not have been familiar with, and also how she was able to make so many strides in bone health. And we will discuss the REMS studies as a non-radiation way of getting good bone health scores, both quantity and quality, which may be a significant advance from the traditional DEXA scan. So on that note, I hope you really enjoy this episode, as it's really a tour de force of holistic medicine and what can be done when traditional providers and holistic providers come together as one. And we look forward to hearing your comments. And on that note, let's get started with the program. Hey, everyone, and welcome back to Wellness at the Speed of Light podcast. We are so happy today to have Margaret Wallace Duffy on the show, who I've gotten to know quite a bit just over the last month or so as we became connected on LinkedIn through so many similar ideas about the emergency health crisis that we're facing, metabolic crisis, the fact that people are not being educated enough on becoming, and I want to quote Margaret on this one because this is her quote, becoming the CEOs of their own healthcare. And I'm actually using that quite a bit now. I just love it. So let everybody know I gave her credit on this show here. So very excited to talk to her about everything wellness. She's done so much to help patients all over Canada and some in the United States as well to achieve the health and wellness that they're looking for through so many different ideas, modalities, really out of the box thinking. So excited to pick her brain today about everything that she's done in health and wellness. So on that note, thank you for being on the show, and love to hear how you first even got into this space and then became such a well-known figure in the space.
Well, first of all, thank you, Dr. Sinicropi. I couldn't be more excited to be here. And you're absolutely right. We are aligned in our way of thinking and in our passion. It's palpable coming from you. And I always get fired up when I get to have a conversation with someone like you that shares our vision in collaboration and prevention and integrative health. So, where does my story begin and how did I get started in being so passionate about preventative and integrative health? It really is my own health story. And as a very young girl, a competitive athlete, I went almost 10 years from doctor to surgeon and not getting answers and suffering, but I didn't look sick and I didn't look like my story. I admittedly a type A personality. I'm a bit of a go-getter. I was a competitive athlete. So loving families, very supportive. So when I'm doubled over in excruciating pain and a distension in my abdomen that looked like I was 8 months pregnant and vomiting and all kinds of things that really was hijacking my life as a young girl before menarche, but certainly after menarche. It was very discouraging because I was told labeled everything from a hypersensitive only child to a drug-seeking teen to a competitive athlete with a nervous stomach. But I knew there was something seriously wrong with me, and no one was listening. So what did I do? I soldiered on. I continued to build resilience, to keep pushing through. But I got sicker and sicker until finally, 3 years in a row in university, I ended up in hospital and I finally said, I'm not leaving here until you find out what's wrong with me. And long story short, we could do another whole podcast on my diagnosis of severe endometriosis that caused 4 bowel obstructions. I had a rare case of endometrial type tissue on my lung, caused a lung collapse. I've had a fecal transplant because I almost died from a hospital-borne infection when I was hospitalized, and on copious amounts of antibiotics. So I was one of the first people in Canada to have a fecal transplant, and that's another whole story. It saved my life. But what I learned through that very challenging time that impacted every aspect of my well-being, mentally, physically, emotionally, spiritually, and even financially, was that if it wasn't for allopathic medicine, wasn't for people like you when I needed it, I wouldn't be speaking to you today. But equally and as profoundly true, if it wasn't for complementary medicine, did you notice I didn't say alternative? Because that's not my mindset.
Thank you.
Yes, I'm a science girl. My undergrad's in kinesiology. My postgrad here in Canada is very different than in the US. A lot of the training in the US is very different. As a registered massage therapist here in Canada, it's extensive training. You write a government board exam. I was an examiner on the board for many, many years. What my journey taught me that without taking both the allopathic medicine and the complementary medicine and putting the patient at the center and empowering them with education, I wouldn't be here today. So I took a leap of faith 32 years ago on April the 6th, 1992, to open Wallace for Wellness. Now, I didn't call it Wallace for Wellness at the time because as a massage therapist with a background in kinesiology and the consciousness of most people, and certainly medicine, no one knew what integrative and preventative health was. In fact, my own family thought I was hugging a tree and howling at the moon when I said I wanted to open this integrative clinic because no one was doing it. But I knew I needed to, and I had a big vision, a vision to bring all different types of healthcare professionals under one roof, where we collaborate and work together, where we look at a problem from an integrative lens, and where we empower the everyday person to play an active role to become the CEO of their health. And I got to tell you, Dr. Sinicropi, I knew it was going to be an uphill climb, but I knew it was worth the battle. And so I first called it Wallace and Associates. So it sounded like a law firm. And over the course of the many decades that I ran the clinic, 30 years to be exact, it morphed into Wallace for Wellness, an award-winning preventative and integrative health clinic with 80 to 90% doctor referral. And when I sold the clinic 2 years ago so that I could do more of this legacy work, which we're going to talk about today, and other things where I could educate and empower the masses, we had 45,000 patients in our database, something that I was very, very, very proud of. because we empowered everyday people to recognize that they needed to take accountability and that the system needed to look at prevention and preventing disease from happening. Of course, we need people like you in a surgical suite when somebody needs your help once they're broken. But we need to look at what can we do long before to prevent chronic disease and to empower people even once they have a diagnosis to live well and to live beyond that diagnosis, to get back to health so we're not straining a system. And that's exactly what I've done. And 2 years ago, I sold the clinic so I could do more legacy work, which we're going to talk about. So that's why I'm so passionate, because I've lived it as a patient. And I've literally climbed myself out of a hole and stocked my toolbox. And now I'm here to stock the toolbox of others.
That's a great answer. And what I'm finding with more and more people that I'm interviewing about folks that have decided to get into the wellness space, it's their own personal stories that have dragged them into that space. I've had really good conversations. I had Neil Gannon on the show, wrote this book, The Vitality Code. He started with his own personal story and no one was helping him. He was going from provider to provider. He was getting all these, these different creams and then tried all these different solutions. And finally, by changing his diet and lifestyle, he was able to overcome that. And we're hearing that more and more. And I have so many people reach out to me now that I'm very deeply involved in wellness and prevention on social media sites, asking all kinds of questions where they've literally been spinning their wheels in the allopathic medicine world, going from provider to provider and not finding answers. And many people just end up finding answers in the strangest places, let's say. And so, but what you're doing is amazing because you're putting yourself out there as somebody who is an expert in these things. You've dealt with it for a long time. You built these amazing clinics with thousands and thousands of patients under your care, primarily physicians. And it's amazing that it was physicians that were driving the business to you, because that's one of the most challenging things that we see here is getting physicians to be comfortable referring into complementary kind of centers because they're so used to thinking a certain way. So what you've done in that space, I'm going to ask you about how you did that, because that really, I'm really curious as to how you did that. But the one thing that I want to share about my own story, and it goes along the lines of what you talked about, I really was excited to get into this space from seeing thousands and thousands of patients whose primary complaints were, I don't feel good. I have this condition and I can't find any help. I'm obese and I don't know what to do. And I've been to all these people. And so I started getting more and more nosy into their lives, learning about it, re-educated myself, went back to my basic science, learned all these, complementary techniques and things, outside of my scope as a spine surgeon, just put more of my physician healer hat on. And there are so many people that are undergoing kind of what you were undergoing, where they cannot find any answers. And I love the fact that you just sat there and you just said, you know what? I will not leave this room until you guys just kind of figure it out. And it was great that you found some physicians that were able to kind of solve that problem. So thanks for that great answer. Going back to the question I really want to ask you is, how were you able, with all the things you do, how did you get into the minds of physicians, allopathically trained, who then had the ability, the trust in your brand to be able to send patients your way? Was it just like they saw so many good results from the initial patients, or how did you do it?
It's a great question. I love, and this is where I get so excited because, I think one of the things that I've always believed, and this is my upbringing, you have to earn the respect of others and by getting results. But that doesn't just come overnight. That comes with perseverance and consistency and effort. And especially if you transport back 32 years ago, the mindset, and even to this day, and it's not the fault, and I want to say this very candidly, and I'm sure you'll agree, I've got a lot of friends that are doctors and surgeons and pharmacists, and it's not their fault. That is not their training. This pill for nil, wait till it's broken, approach to sick care really is the way they've been taught, and it's not their fault. So they're leaning in on the tools that they've been shown. They don't know the tools that others have. That's why I won't use the word alternative medicine. It's complementary, because the tools you have as a surgeon in your toolbox and the tools I have as, as a massage therapist with a background in kinesiology, and I've got my professional designation in aging and all the years of clinical experience, are different. And when we come together and we help the patient in the center, who, by the way, knows their body better than any of us. When we recognize, if we come together, we're better together as one, as I like to say, you can see my sign right here behind me, then that's where the magic happens. But over time, you have to earn the respect by getting the results. So how did I do that? I was bold. And I literally, when I was opening, before I wrote, this is a true story, before I wrote my government exams for massage therapy here in Canada, I wanted to be out of the gates and down the road ahead of my peers. And so I literally opened a clinic and leased a place before I wrote my government exams and even knew if I could practice, because I was determined to make a difference. And so there's a lot on the line. But as soon as I passed those exams and I opened that clinic, of course, patients aren't just flowing in the door. You got to go out, you got to pound the pavement. I would speak to anybody. I would do speaking engagements at any conference. But I also did this. I went to doctor's office with a referral pad in hand, with a letter that introduced myself, my mission. And here's what I also did. I offered to give complimentary treatments to the physicians that I was hoping would eventually earn the respect enough that they would refer to me. But I knew that who was I to assume somebody was going to refer to me, especially in the early days before I had those outcomes that would speak for themselves, and then word of mouth would happen and patients would go and say, this is the result, and they'd see it. But who am I to expect that you're going to refer your patient, which is a reflection on you, without seeing what I do firsthand? They would come to my clinic and I would treat them and use the tools that I had at the time. And that grew and changed over the course of the year, because I'm a lifelong learner. So I'm always taking new courses and always looking at the latest science and always looking at layering the tools that are in my toolbox as a practitioner. So I would go and actually say to them, come and see me. Let me treat you. And that hour on my table, not only did they receive an experience in their own journey of wellness and prevention, they saw the results, and I earned their respect so that they could feel confident referring to me. And then once that started happening, we're getting the results. And when you get results, because at the end of the day, I mean, we all have, let's be candid, we all have egos, but I want to work collectively and collaboratively. I don't believe in competition in the healthcare space. I believe that everybody, often there's a place for all of us to play a piece of the puzzle from different lenses, for whether you have diabetes, maybe you're going through cancer, maybe you have osteoporosis. There's not one magic pill, one magic answer, one magic modality that's going to fix that problem. So why are we so frightened of welcoming a team, as long as they're evidence informed, they have a mindset of collaboration and patient-partnered care? Because as you just said a few minutes ago, so clearly, and this has been my experience, if I had $1 for every patient that said to me, Margaret, I don't feel right, but my doctor says I'm in with normal range of the blood work, or normal range of the x-ray, or whatever testing it is. But intuitively, they know. And I call it the opportunity gap. So we're healthy here, and then we're sick here. And in here, there's a wide range of opportunity of getting into action to prevent from getting over here when we're sick. But in the system that we exist in currently, and for a very long time, this pill for nil, really wait till we're broken or there's a crisis, until you hit that threshold, until your T-score is minus 2.5. Now it's even earlier, and they're wanting to push medications, which that's another story. But we don't do anything and we wait. Whereas I live in this space, this opportunity gap that's saying, whoa, wait, hang on. Let's get into action. Listen to your body, and let's see what we can do through lifestyle changes, through different modalities, through nutrition, through mindset, through exercise, all of the things. So we can slow down progression of disease, or stop it, or even once you have it, reverse it in a lot of cases. But we have to all be in this arena together: conventional medicine, complementary medicine, and the patient. So that's how I earned the respect. And then over time, I did a lot of public speaking. I would go on television and speak to anybody that would listen. And that was before the internet. We didn't have this. I was sending fax machines to a national TV show saying I needed to be a guest on your Wellness Wednesday. A year, no word of a lie. Every day for a year, I faxed a national television show here in Canada to say that I wanted to be a guest on their show. And I got to tell you, Dr. Sinicropi, I'd never done television before. I'm now media trained and do a lot of it. But I was bold because here's why. I had a passion, a deep passion and commitment to educating and advocating for change. And the way to do that was through the media. Now, look what we're doing here. How amazing that online we've connected and we can share internationally. But back then, I was faxing every day until they finally said, oh my goodness, we're going to have this crazy woman on the show because if we don't, she's not letting up. And that opened doors because that then became my platform to educate the masses, to earn more respect of other healthcare professionals, and to show other colleagues, both from conventional and complementary medicine, that we can actually work together. But not all complementary medical professionals are created equal. And that's why, if I'm going to be a reflection on you, then of course we want to do our due diligence. And I think that's sometimes where people in the complementary medical arena go wrong. They're equally as responsible to be evidence informed and to make sure they stay in their lane. And that's what I'm really good at. My biggest strength is knowing where my weaknesses are and when to refer. But I make a really good referral. And what's the bottom line? The patient gets better, better outcomes, and everyone looks better. And the patient is improved. And that's what I'm here for.
That was, again, another absolutely brilliant answer with a million things to unpack. So a couple things that I want to unpack from that is, number one, when you talk about getting physicians comfortable referring into alternative medicine, that brought up an interesting thought that I had yesterday. So yesterday I saw a lot of patients in clinic, surgical patients, and it was very interesting. I had numerous surgical patients referred to me from physicians that I've done surgery on myself. They've had spine surgery by me. And the physicians that I've operated on have referred me a huge amount of patients. I mean, literally that once, they send me everybody. But interestingly, on the flip side, now that I'm still, I do a lot of spine surgery. We've got a thriving clinic trying to help people. However, we're also on the wellness side. I'm also on the wellness side with these wellness centers. And it's very interesting to me. I have a lot of physicians that come to the center themselves. And the other day I was talking to one of the physicians that is a client, and he was saying how much relief he was getting from the treatment. He's only been there for a couple of weeks, but it's funny because he started telling me that he referred me one of his patients. But when he was talking to the patient, he told me how he said it. And right away, he had to give all this, well, I'm treating there. It's working for me. I don't normally do this, but you probably should go there because you've got something similar. But right away, I just kind of laughed at him and we joked about it. But inside, there is still this discomfort with sending people over into that complementary space, even a complementary wellness center that is founded by a surgeon who, I do a lot of surgery. I know these physicians that are seeing, but yet they themselves have trouble overcoming that because in the back of their minds, they're thinking, oh my God, I don't want, I just want to make sure this is good. Even though I provide them study after study on photobiomodulation and class 4 laser, there's thousands and thousands of pieces of literature on this stuff, well vetted. Not only that, photobiomodulation is FDA cleared for musculoskeletal pain, and it's deemed by the FDA as clinically non-significant risk. They have nothing to lose by sending their people, but yet there is this barrier that we are trained on that, oh my God, that's smoke and mirrors. And I'll be the first person to say, listen, a couple years ago, I didn't even have this stuff on my radar. And now I can't stop talking about it. Why? Not because I just want to do it or I own any of these products. I don't have any affiliation with the companies. However, the science got me. As a scientist, it absolutely got me. I was blown away by the science on some of these complementary kind of medicine things. Actually, I would go as far as just say it should be the base treatment for people, not even complementary medicine. It should be called something like health medicine. And then we can call it, the other stuff is sick medicine, right? What I do when somebody really needs to have spine surgery or whatever, but the other stuff is really health medicine, not even complementary. So it is kudos to you, honestly, for being able to convince doctors that these modalities can make a massive difference in their patients' lives, where, and I think that's the number one struggle in the United States. And I don't know what the subtle differences are between US physicians and Canadian physicians and how they think, but I will tell you, man, that the struggle to try to get some of these concepts out, it's so difficult.
Let me be clear, and I love what you're saying, and there's so much there to unpack as well when it comes to looking at how the structure that physicians exist in. Once again, I'm going to give them kudos. It's not their fault. There is a real culture around, making that referral and it not being accepted by your colleagues, and that's scary. And I get that, and I recognized really early on that I'm not a physician, but I know my role. I'm very confident in the role that I play within this healthcare. And I'm uniquely positioned because I'm not a physician, which some people would say, well, who are you? And I still, don't get me wrong, US or Canada, we still have a lot of work to do. There's a lot of physicians that are sitting on their hands and not making those referrals, even when they know they should be, because of the judgment that they might receive. So we've got work to do in that arena too. So thank you for being a surgeon that's actually boldly calling it out, because if we don't call out what's happening, you don't give permission for others to also. How do we change if we don't slightly try to change the temperature and the judgment that's existing in the structure that everybody's working in? I don't blame physicians for feeling worried about stepping into a realm that they don't really understand. And that's why I always lobby for anybody working in the complementary health space, that we have to earn the respect, show the science, see the outcomes, and not be hugging a tree and howling at the moon. There's a lot of nonsense online and a lot of pseudoscience that we've got to be cautious of. But these poor physicians, I'm uniquely positioned because I'm not a physician, that I can actually speak more boldly and have for years, because I don't have as much to lose. Now, granted, I built a practice from the ground up. And I also have had broad shoulders, Dr. Sinicropi, because I am not frightened of having a lot of no's. And maybe it's the Taurus in me, but I go back and I go back and I go back, because if I truly believe and I'm confident in my clinical skills or what I think might be helpful for this person and they're getting results, I want to be their advocate. But most importantly, I want to play a role in empowering that patient to be the advocate for themselves. I like to call it, I am there to build their health esteem. We are frustrated with everyday people. Our systems are strained, whether you're in Canada or the US. And access to healthcare can sometimes, certainly here in Canada, be really challenging because the system is strained. It's not the patient's fault that we've taught them to be passive participants in their health. It's not the patient's fault that they don't know where to turn. And that, gosh forbid, the number of patients that have said to me, well, when I challenged my doctor, he said, oh, what have you been on? Google, Dr. Google, very admonishing. Yes. And we've got to find a middle ground where we respect, as I do, the knowledge of physicians and surgeons, and I want to learn from them. I learn from people like you every day. I'm a sponge. But I also love, which is why I connected with you, I love that you also want to learn from me. But that took years of earning that right for you to earn my respect, or want to learn from me, pardon my miss up there. But I think that's what a lot of people don't want to do. I had to really, year after year, and show the docs that I was getting these and meet them where they're at, not extreme, little bits at a time, showing them here, here, I'm going to try this, helping them make their job easier when they are stuck and their only option is maybe to prescribe. Well, have you thought of this? Perhaps you could do that. And when I'm treating their patient with that and they're getting results, I would take the time and the energy to write them a note or pick up the phone and call them. Or I've had it go the other way, where I'm getting a call or an email from a doctor or surgeon that's saying, what did you do? This is cool. And I want to know. But we still have a long way to go. And I think what excites me about where I am now and where the world is now, I think one of the gifts of the pandemic is that people are ripe and ready to see change when it comes to their health. When we needed health during the pandemic, we take a lot for granted. Certainly here in Canada, we have an OHIP covered social medical system where when you need something, it's there. Well, during COVID and with a strained system and burnout of doctors and access to care not there, we had a lot of disempowered people that were getting sicker and sicker, and they didn't know what to do. I was online helping to coach people through those times when they couldn't see their family doctor, show them a stretch or show them hydrotherapy or whatever within my skill set. But what's exciting is that was a gift, because now we have a strained system because we have disempowered patients and we're not investing in prevention. Well, what if we switched that around a little bit, invested more on prevention and education and empowering and stocking the toolbox of the average North American person, and then helping to collaborate and teach how physicians and complementary professionals can work better together, which I'm doing with the portal that I have and other things that we'll talk about. Now it's a very different conversation, and it saves the healthcare system, but more importantly, and I love you talk about this, longevity medicine. We have people that are living well longer, not just people that are living longer and not well, because you know the stats. We don't have to go far to see that people are living longer, but the last 10 years of their life often are not well. Is that what we want? Certainly not the way I want to see the sunset of my life happen. So it needs to start now, because what we're doing now or not doing now is going to predict what we can do or can't do 10 years from now. And I'm up for that kind of medicine.
No, absolutely. And it's funny because that's one of the ways that I talk and relate to my patients that I see in front of me, those patients that are just not doing well, right? They're on a boatload of medicines. I love when they come in with their little baggie with all the drugs in there. And I ask them, what are those drugs even for? And they're like, I don't know. I take the yellow pill at 10, and then I take 3 blue pills at whatever. I'm like, well, how did you end up on 23 medicines? You're 46 years old. Do you want to spend the next 30, 40 years potentially of life just feeling sick? And so many of these people have given up. And I talk about this so much. It's such a frustrating thing for me. And that's why I just decided to pick up the torch and just do it. And that is a good segue into what I wanted to say next. Was you hit it right on about sort of that discomfort with recommending things that are outside of what your colleagues believe in. And I can tell you, when I first started down the wellness road, even when we first opened our clinics, I was a little bit leery about talking too much about it or being too public. First of all, to be honest with you, as far as acceptance, it's actually been really exciting. People are actually very happy about it. I get messaged all the time from physicians. Oh, how are you doing this? What does photobiomodulation do? I see you posted this thing. And now some of the other physicians that are into this stuff start supporting me. I'm supporting them. And it's starting to become like a little crew that's trying to get this message out. But really what spurred me to be, okay, I understood the science. I would have never gone down that opening all of these centers, right? Or plan to open all these centers. We're just kind of in the infancy of that. But what really was amazing is every time I would go and visit our wellness center, the first one that opened, I was bombarded by people that had stories of just unbelievable, the centers that had gone to seeking help. And here they are getting, light therapy and oxygen therapy, all the other stuff we do. And they're like, this is the first time in the last 15 years that I've been able to get a good night's sleep, or I haven't had a headache, or my rash went away. We treated all kinds of stuff. Every time I heard one of those stories, you talk about fuel, just giving me pellet after pellet. It's just like in those video games. Every time you grab one of those pellets, you kind of get bigger and bigger and more puffed up. The more I saw that, the more I realized that it was something that, even though, I was going to be a founder of these centers, I couldn't hide kind of as the silent partner and not say anything, because I am a physician and people have my trust because of what I do in my other, wearing my other hat. And so I just decided, you know what, I'm going to just go full all out on this because the world needs this. And honestly, there's not enough of us that have this kind of expertise that are doing this. And certainly, you know, there are some orthopedic surgeons out there and some spine surgeons doing some of it, but it needs a lot more. So I was happy to take up that mantle. And now obviously in 2024, I've really picked it up. And I'm just going to run with it as hard as I can. So thanks for bringing that up. It's so interesting of kind of having that mind shift. And this is something that we've talked about before. It's just sort of not understanding, but even from the provider standpoint, okay, even if you go to the best schools, right? You have the best training, you're at the best hospital, you do all this and that. At some point, it's got to bother us as physicians that we're doing the same stuff, getting the same results, and then doing the same stuff. Like that's what we've been doing. And so diabetes care, type 2 diabetes, what in the world are we doing? I don't know. It makes no sense to me, right? The way we treat even hypertension, depression, right? We're treating depression with drugs. What about changing diets? I mean, there's an entire science now, right, about the mind-gut connection. Literally, there are conferences about this stuff where you could just completely change somebody's life just by changing their diet, their microbiome health, and on and on. So I know I'm preaching to the choir. I know you're getting so fired up. You're ready to come through the screen. Go ahead.
Well, and because it's so relevant to what you're just saying. And first of all, I have to say thank you for boldly going. You have to have courage to do what you're doing, and I respect that immensely. So I needed to. And you will lead others to do the same, which is so cool. But when you're talking about the gut biome and, you know, diabetes or depression, I truly believe my health story, when I keep believing I've had a lot of these things happen to me. Like I talked about 10 surgeries, 4 bowel obstructions, a lung collapse, a fecal transplant. I went through menopause at 39. And I believe it's happened to me because I have the ability to figure things out from an integrative perspective, and then the voice and now the platform to share what I've done to help advocate and create change. I love to be a change maker and to breathe belief into people that they too can change their life like I did. So when we talk about the gut biome, I know firsthand, and I think this is to your point as a physician, the physicians that come to you as a patient, and yet they're still nervous. And I get that. It takes, it's a muscle you have to sort of keep building because I've got many. Dr. Christy Prowse, I'm going to call her out. Dr. Christy Prowse is an OBGYN here in Canada, brilliant woman, had her own health issues. We did a 3-part hormonal health series, which I'll be happy to share with you. I'm writing a blog about it right now. 10 years ago, long before menopause was getting a lot at the moment in the media. And why? Because I was going through menopause at a very young age and there was no talk and no help. But Dr. Prowse, she struggled. She was struggling as a physician, a mother of twins, a high-pressure job, the head of the department in her hospital, and nobody was giving her answers to all of her things. So she did what a type A personality would do, and we talked about this in the documentary. She went to see a Chinese medical doctor and a naturopath the same day. And both of those people said the same thing to her, which was this thing called adrenal fatigue. And she immediately said, well, hang on, I know the adrenals, and I understand the extremes of disease, Cushing's. She said, but I knew I didn't know. Well, what was this adrenal fatigue? That prompted her journey to functional medicine. So to your point, often it's our own journey that prompts us to wake up and recognize if we just open the door a little and let some of that other stuff in to augment what we're doing in conventional medicine, all of a sudden the game changes. And she left the hospital and became the founder of the Institute for Hormonal Health. She would be a great guest on your show. And in doing that, she's helping thousands of women. And now she's doing a lot more than that. But I'm telling this story because when I was so sick with a hospital-borne infection, C. difficile, and almost died with young children, I was admitted to hospital with a severe food poisoning. And they told me I had infectious colitis and they were pumping me with antibiotics. I had a resistant form of C. difficile. And next thing you knew, I was on IV vancomycin, and I can't tell you how sick I was. lost 40 pounds, was running to the bathroom 50 times a day, was highly contagious. I'm self-employed. I couldn't treat patients. It was awful. And I was spending taxpayers' dollars in the hospital trying to be fixed. And the only option that was given to me was more antibiotics and more antibiotics. And I felt sicker and weaker and sicker until here in Canada, a big broadcaster broke a story on a national TV show on fecal transplants and the science behind it. And I'll never forget that day, Dr. Sinicropi, when phone rings at 10 o'clock at night. I'm watching the TV and I'm online contacting Dr. Thomas Louis at Calgary Foothills Hospital because he was saying that Canadians and doctors have to get over the ick factor. Instead of over-prescribing antibiotics, we need to look at the gut biome and we need to do a fecal transplant. And they're doing it in other countries. I was emailing him. The phone rings. It was my family doctor, who's an amazing guy. Kudos to Dr. Javan. And I said, you're watching the CBC, aren't you? He said, yes. I said, I'm already emailing this doctor. Fast forward, I flew 3 weeks later with my son's fecal matter in a Haagen-Dazs container, and the joke was, "Don't go to the Haagen-Dazs container in the fridge downstairs because you're not going to get what you thought it was." And I underwent one of the first fecal transplants in Canada, and instantly, when you want to talk about the gut biome, looking at that and what it can do for your mental health, for your absorption, for your energy, for all of it, it was like night and day. I flew to Calgary, isolated in the back of an airplane, and went to the bathroom 50 times. When I flew home 2 days later after the transplant, I went twice. Now, did it take me months with my integrative health team to build back up my gut flora with all the integrative tools? Yes. What a difference. I experienced that firsthand. And I'm telling you this story because you're right. When we experience it, and when we look at what are the various tools we can use and prevention, it makes a massive difference. And that's the way we need to approach, I believe. And that's the role I'm playing, to bring doctors and specialists together and researchers. I was then interviewed by 6 gastroenterologists, and there's now a poop pill because we're a pill-popping society. And don't get me wrong, it's easier than doing a 2-hour continuous enema, without a doubt. But I wanted to be instrumental, and it was my experience. And then I came home and wrote a blog that was seen globally, and it's made a difference. And so these are the conversations that we have to have, but it takes people like you that are boldly going first and opening that door for others to follow you.
Well, thanks for the kind words. That's a great story. Thanks for sharing that. I think that our listeners will definitely appreciate that. And how many countless books have been written about people figuring out their own health issues? I mean, thousands and thousands of people that just couldn't find answers. And sometimes they find a wonderful allopathic physician or somebody like yourself, or just literally become such experts in the area that they figure it out themselves. Oh, I'm missing this vitamin or this mineral, whatever it is. I mean, there's just countless, stories of that stuff. One of the things that it just popped up in my head as we're talking is I feel like my own personal journey into this kind of, again, let's just call it the complementary space and understanding it. It's really, it goes back to the Matrix. Right. I feel like the machine, like one of those machines came, pull me out of the pod, and I just wake up into the real world, because I feel like a lot of what we are surrounded with is just kind of, we are in these echo chambers where we talk about the same stuff over and over. And unfortunately, in allopathic medicine, it is a lot of what pharma can we use, what procedures can we do, but we're not thinking about these other things, which have, like, again, a massive amount of research behind them. And so when my eyes were open personally, again, I feel like, I just kind of came out of the Matrix, all with all that goop on you, and you're just looking around and you're opening your eyes for the first time and you can hardly see. I just remember that weekend a couple of years ago when I one of our partners at Hypercharge Tram, when he sent me about 1,000 pages of articles, and I just started reading through them. And then I spent an entire weekend reading everything I could on photobiomodulation and laser therapies and some of the other things. I was in shock. I didn't even know what I was reading. I'm like, are you kidding me? No one has ever called on me. I have people calling on me day and night to sell me stuff all day. None of this stuff was ever brought to my attention. And I just kind of felt I don't know, I felt cheated. I wish I had known these technologies, not just, not just for everybody else, but honestly, admittedly, personally, because I think that some of these things that we do are, they can improve longevity, they can improve your health. You just feel so much better, and they're so simple compared to
Yes.
taking pills that have so many side effects. And again, like you said before, and I appreciate that you defending, us as allopathic doctors. The truth is that it's like countless lives have been saved by procedures and medications, especially in infectious disease, things like that. It's just amazing how far medicine has come. One of my favorite books is The Great Influenza, which talks about the amount of medical knowledge that was gained during the 1917, 1918 pandemic. It's amazing. As a physician, I'm so proud. When I'm reading that book, you almost get goosebumps from reading like the bench work that was done to figure out. They had no idea why these people were getting sick and dying. No clue. They didn't know if it was a virus, a bacteria, no clue. And so it was a lot of trial and error, and that's the beauty about science. And so science is amazing in so many different ways, and medicine has saved countless billion, I dare say, in the last 100 years, 1 billion lives. It's just crazy what we can do with medicine. However, medicine, as I always talk about on my shows, what we consider medicine, Western medicine, allopathic medicine, is only a small part of the totality of the pie. When you look globally, there are so many things people are doing, as simple as meditation, breath work, all these things we talk about, anything that stimulates the vagal nerve. I know we're going to talk about like directly stimulating the vagal nerve, but anything that stimulates parasympathetic, stuff. There are just so many medicines that don't have to do with man-made stuff. They're just available to us in nature. One medicine is the sunshine, right? Walking in nature. That's medicine. We don't talk about that enough. So I could go on and on and on. I know I'm preaching to the choir, and actually probably our audience, most of them, we're kind of preaching to the choir at this point. One other thing, actually two other things that I wanted to share. I wanted to go back. It's very interesting on the physician resistance and how much, if we could overcome that, and I'm literally going to speak until I'm blue in the face, and because I have more color in me, than you do, it's hard for people to tell when I'm blue in the face. So I really have to go to extremes to get blue in the face, but I'm going to get blue if I can. And that is, the world and people, our society is going to be so much better if physicians, the people that have the power they're not just physicians, physician extenders, nurses, everybody in the game, physical therapists, occupational therapists, people that are quote unquote in kind of that allopathic kind of path. The world is going to be so much better if we all educate ourselves on what is possible and make that transition into saying, yeah, what I do, I'm really proud of what I do. I can really help a lot of people, but I can't help everybody with what I do. Certainly, as a spine surgeon, I can only help a small sliver of the population with the tools that I have. Not most people should not have spine surgery. End of story, period, right? But I can help a small too. So I need to have those tools where people come in with every complaint that people would ever want to hear of. Some are one of those things you say, man, I can't even unsee what they just told me. Like, they tell crazy stuff. I don't have a solution for that. But you know what I don't like? I don't like to tell people, well, I don't know. That's too bad. Like, without having a referral source or just having some at least basic knowledge on all these other things, because they're coming to us for help. And they think that as physicians, they think we can help them with everything. We can't just say, oh, I don't know, or whatever. That's not my problem. I do spine surgery, not my problem. That's your problem. Go talk to your doctor, all right, who may not have a solution either. And then it becomes this crazy, crazy, vicious cycle. But I wanted to share another thing. I know I talked to you about some of the clients I have. It's interesting because I spoke to not even somebody that's really a colleague, but I spoke to an infectious disease specialist here in this state that I don't really work with. I just happened to have a conversation with them at a social function. And I was just telling them, hey, what do you do with your post-infectious Lyme's disease patients, all these post-COVID patients with all these symptoms? And it's interesting. Of course, I knew the answer before I asked, but I just ask it because I like to get some of this stuff out. Well, I don't know. So I say, well, where do you send them? What do you tell the Lyme's patients? What do you tell, these things? Because you're infectious disease. The antibiotics are not going to do anything at this point for them, or antiretroviral. They've already they've cleared it, or it's clinically undetectable. There's all these reservoir theories for both of those illnesses, whatever, and they say the same. They're like, well, I don't know. I say, well, would you consider referring them for photobiomodulation? Because there's really good data. I mean, there's amazing data on post-COVID, right? And some good data on Lyme's disease and some of these other post-infectious things. Right away, I don't know. I don't think that works. Nah, it doesn't do anything. Based on what, it's this block. And I am again, until I'm blue in the face, I'm going to convince people, not necessarily, it's not about referring to us or referring to you or whoever it is. It's about just having an open mind and figuring out, just that shift. We really need to work on that shift, as well as working on the shift, like you always talk about, being the CEO of your own healthcare. So it really has to be both. It has to be the track where we educate the people and the track where we educate the providers. If we don't, you need both, because that's what causes change. We need real actionable change. Am I turning blue yet? I don't know. Maybe
I can feel it. I can feel it through the screen.
You're feeling it?
And I'm the same. And I couldn't agree more. And I always say this, and people, often patients will feel very taken back, and I do it in a kind way, but to shift their mindset and really to make them stop and think about the role that they play in their health. Mm-hmm. And instead of being this passive participant where they walk to their doctor like little Trojans and say, "Fix me, doc," and wondering why physicians are burnt out and high rates of suicide in medicine and people not wanting to go into healthcare. Well, no kidding. Because to your point, both sides have ownership in the solution. And until we switch the mindset that we all play a role in this broken system and that we all have to find a better way, even from the perspective when you were talking about, doctors just saying, well, I don't know, right? Or surgically after, and I could go on, do a whole show on this. Surgeons will, maybe they take your gallbladder out and you might have some small laparoscopic incisions, but you've still gone through a surgery. But once that's done, on their way, or maybe it's a C-section is a perfect example. I've seen thousands of women with C-sections. And as long as you aren't oozing with infection and you've had your beautiful baby, they know nothing about scar tissue. They know nothing about fascia. They know nothing about the long-standing impact that can have on your nervous system, on your emotional system, on every system in the body. And they just like, oh, no, you're fine. And when they go back and they say, yeah, but I'm having pain and I've got, all the things, they're like, no, you're fine. There's no problem here. What we also have to recognize is that patients need to be heard. And it's so heartwarming for me. I was in clinic this week and I was tearful when somebody sent me a message afterwards saying, thank you. It was the first time I've ever felt truly listened to, validated. And then her mindset, the gate is open. She's willing to do the work necessary to make that mindset shift change, to get into action and take some ownership for her health. Because at the very least, initially, I validated that what she was experiencing, I was going to listen to. I may not have all the answers, but I wasn't going to just say, oh, no, it's fine, it's normal, or I wanted to hear the human being, not the condition, not the, what they were diagnosed with, but their experience with that diagnosis. And then I've learned a lot from listening to people and then asking questions of other colleagues and trying to bring an integrative team together to help solve these problems. And so I think that's really important to mention as well. Both sides, as you said, but also we need to stop. In medicine, we need to listen and validate.
It's interesting you say that. It's so important about people feeling like they're not heard. So just to take it back for a second, the conversations that physicians have with their patients have gotten shorter. Okay. Yes. It's gotten less in depth. Some of that is absolutely not the physician's fault. That's an entire other rant that I could do. I mean, I could do a 2-hour rant and just post it, because honestly, it is a huge, huge problem the way physicians have just been turned into people that have, 8 minutes with people and you're just kind of in and out. And that's very difficult if you're trying to do preventative medicine, integrative health, it's not possible. I'm sorry. It's just,
you got one problem you can share with me. Well, when's the last time as a physician, every system in the body is interconnected. How can you get to the root cause of something when somebody says they have one symptom that they're allowed to talk about? That's some of the rules. And I get it. It's the structure that physicians are working in and the time. Next, their hands on their door of their clinic room before the patient's even able to process what they were hoping to ask. And it's one thing, but it's far more complex than that. So it is a bigger issue, and we're not trying to solve that here today, but these are all the reasons why we're doing what we're doing. Yes.
Yeah, and and on that, so I think that part is unfortunate because of the corporatization of medicine and the fact that most, in the United States, if you just look several decades ago, there were so many independent practitioners of medicine. But unfortunately, because we've corporatized everything, so many of these physicians and practices have had to get wrapped into systems, some better than others. Some systems are amazing, some systems aren't as good. But the problem is that when you corporatize it, you're not that personalized touch. They're being forced to hit certain metrics. And that's really what I wanted to get to, because again, that's a whole other discussion. And as a physician, I think that we need to talk about that ad nauseum. And I have some great guests coming on that are physicians that have been at the forefront of medicine and have been in the boardroom and have made all those kinds of decisions. And I can't wait to talk to them about that. But the other, the other problem that we face in medicine, I've talked to a lot of colleagues, outside of my own specialty, about discussing obesity and other sometimes uncomfortable topics with patients. And I cannot tell you how many doctors express to me that they are not even comfortable speaking to their patients about obesity for a couple of reasons. One, they don't want to upset, quote unquote, upset the patients, but also if patients are unsatisfied about the way that topic is brought up and the physician then gets a quote unquote low score, if they're part of a system, that scoring system puts them down in the pecking order of things, and there could be some consequences to that, whether it be for promotion and other stuff. Like I said, we'll get into that in another thing. It's very important, and this stuff has to be talked about openly, because if we can't tell the truth, we can't tell the truth. But what I find and what I plead with these guys is, I've been talking to my way before I got into all the kind of the complementary stuff. Obesity has always been a pretty big passion of mine, just because as a spine surgeon, you could imagine who comes through my doors. So I've always been on the kind of the diet and nutrition thing. I just added all these other things more recently. But I can tell you, honestly, I cannot remember one single interaction that I ever had with a patient when I brought it up very politely and very much in tune with me wanting to know all about them and taking care of them as a person. I have not had one patient ever, at least to my face, or even made a complaint, be upset because we discussed that. In fact, I cannot tell you how many times that it has triggered the patients to break out into it. We always keep tissues in the room just because they're having, a lot of them are having spine surgery. They need tissues because it's, but how many patients, when you actually talk to them about saying, well, listen, you got a spine problem and we're going to treat you like this, but we really need to talk about something way, way more important. And that is your own health, because I care about you as a person and your life going forward. You are going to have if they're not already in that position, you're going to have a very, very difficult life going forward. And then just sharing with them all the knowledge that I've gained on obesity medicine and trying to put them down and looking at their diet and kind of what their nutrition intake is and who they've been seeing and trying to work through some of that stuff. I got to tell you, nothing but acceptance. Nothing but acceptance. The people are so grateful. I recommend books to them. Sometimes they sit with me and they order the book on Amazon while we are talking. I see like the spouse, on there furiously ordering the book. One of my favorite books is Obesity Code by Jason Fung. I think it's great. It's the Bible of intermittent fasting. Again, that's not for everybody, but it's very effective in many, many people. But anyway, I needed to get that off my chest, because you get me, you're just such a high energy person. I have to get some of the things off of my chest. And that is, we need to have these conversations, because for God's sake, okay, if we are not having the conversations, who's having the conversations with them? You got to have these conversations with the people. Otherwise, they're coming to you to discuss this stuff. What in God's earth are you talking about when the person's 170 pounds overweight? I see the people. I don't have anything else to talk to you about. I was like, okay, time out. We're going to talk to you about your meds, your overweightness, your diabetes is out of control, your A1C is 11.9. I mean, what you want to talk about your back pain? Oh my God, we got so many other things to talk about. So anyway, that's my
And the
rant on this topic.
depression as a result of the gut biome, and that
Huge.
whole mind-body connection. I have a soft spot, and I certainly see that on my tables every day. And that's the work that needs to be done, and it can be done respectfully and with compassion. And it's not a quick fix, no. And I know we're in a culture now where we want to pop a pill.
Yes.
And you know how I'm referring to. And there's a time and a place always for pharmacology. I've got many friends that are pharmacists, and there's, as you said, it saves lives, but it's also contributing to chronic disease. And we need to really look at, well, what can we do to really change the trajectory of health for all people at various ages and stages of life through prevention and integrative tools, which is really what I love doing.
And you're doing that. And what you've done, you know, the more I learn about how much you've been able to accomplish, it's amazing. Honestly, it really is amazing. And it shows the perseverance. And you know what? You understand this. There are more of you out there. How do we get them to do what you're doing? There are more of you out there, and but there's barriers, and a lot of it is ourselves. We are often our own barriers because we're just not willing. Because a lot of people are passionate about this stuff, and they'll talk to me privately, but publicly they're embarrassed. I'm like, you're embarrassed to send somebody for light therapy? You're embarrassed to talk to them about intermittent fasting? How far have these outside external forces, which everybody knows who they are, how many of these, I mean, we're bombarded by commercials and food stuff and pharma, how bad it is. The mental state of where we are has gone so far where we literally are, we talk about COVID brain fog. How about, you know, like just advertisement brain fog, information brain fog? I mean, we are so brainwashed, you know, by the powers that be, that we just think it's just okay to eat all this processed food all day, and I'll just take medicine for it. You know, one of my favorite interviews was with, you know, one of the former medical officers from the White House. And it's just so funny. He said, you know, in the communities he grew up in, his name is Bernard, and he's like, yeah, you know, you get diabetes, just normal. It's just regular. And you just say, oh, I got the sugar, and I just take a sugar pill. And his response to them is, well, that's fine. Are you interested in mobility? How far are you going to be able to get around on one leg? Because you're only going to have one leg or no legs. Because that's where these people get themselves to from the misinformation. And in some of the more disadvantaged communities, it's nuts. They don't have any clue. All communities don't have a clue, in my opinion, but we got to start at square one.
Access to some of these things, and you're so right. Those communities also don't have access, and the mentality, like you said, this, you know, oh, we'll just take a pill for it, and then, oh, by the way, doc, I've got side effects from this pill. Can you give me a pill for that as well? When there are things even that are accessible that aren't a lot of money, because some of these things, I mean, I want to be candid, some of these therapies or modalities, they can cost money, and not everybody can have access. But I'm always about balancing that conversation with all the things in the toolbox that you have at your fingertips. You know, tapping is one of them, and there's hundreds of you know, studies on tapping, and that's at your fingertips, and it's free. Nature, getting out in nature, breath work, exercise, movement, mindfulness. I mean, there are many things that are free, but we have to shift the mindset to value those things, because it's not pharma driven, appeal and efficacy, when in fact often we're giving people medicines when they don't need it, and they're feeling sicker, and they feel like that's their only solution because that's what's being taught, and there's no value or investment in prevention. And I see this in my clinic every day when I show people how to do certain things, or I speak at a corporation in workplace wellness, and I pull things physically out of a toolbox and say, hey, let's do this, let's do it together. And they're like, oh my gosh, that worked. But it was simple. It can't work. It's simple. But here's the science, and here's why. But that takes time and energy to educate. Right. And unfortunately, in the system that we exist in, there's not a lot of time to educate. We don't value the education the way, because it's got to be like this. We're overwhelmed. The system's strained. Next, we have to take ownership as people, and hopefully the doctors and physicians will not be so taken back by an empowered patient that's come to you wanting to be a partner in their health. They're not there to challenge your knowledge. I respect that you've gone to medical school and have incredible knowledge, but a patient has knowledge about their own body too. I have knowledge from the complementary medical side. And if we could just as humans, all with the common vision to be better together as one, and everybody's going to live better, and the system's going to be better, our communities will be better. And I truly believe society and socially will be better. A lot of the social, I mean, we've created an epidemic in opiate use and mental health crisis because we're not working together and looking at prevention. So when you started this podcast and talked about crisis, you're right. But that crisis excites me because I truly believe that we're at a pivotal point, which is why I sold my clinic 2 years ago, to do this legacy work so that my kids and future grandkids will look back and say, my mom had a small piece in a much bigger puzzle alongside people like you, Dr. Sinicropi, that's going to change the way and the legacy of healthcare in North America. It's doable. It's not going to happen overnight. It's going to take a lot of nurturing and a lot of rewiring. There's tools to do that, but it's doable and it's long overdue.
Absolutely. You know what? One of my absolute sort of mission statements in a way is that I am on a mission with the army of people, including yourself, and hopefully thousands of other providers from all walks of life, and even non-providers that really want to be on board on this mission to literally, we have to completely change the model of the current healthcare system. We've been talking about changing the model forever, but it is an emergency. It's an emergency because we are just drowning in this chronic health crisis. And you bring up the opioid crisis. And I've had numerous guests on already talking about the opioid crisis, what a mess we've gotten into. And one of some of the most interesting studies on kind of addiction and this and that is I talked about with Dr. Blum as a psychoneuropharmacologist about the way that our pain reward system works in the brain. And the fact that so many of the addictions that we're developing, it's because we're really pretty much screwing up that system. And we are so many of us are so predisposed because of our genetic inheritance to becoming addicted to so many of these things, but you will never get addicted if you are not in that environment. But our environment could not be more toxic. Consumerism, food, internet, everything. We are just bombarded and our brains are not designed to be able to do that. So there are so many different tools, including looking at the genetics of it, which is what I talked to Dr. Bloom about, that we can help to stem that. But again, so much of his research, which is literally, it's pivotal, it's game changing. I mean, it's Nobel Prize winning stuff that not many people are aware of other than people that are in those circles, but that people kind of need to know about. So that being said, the last thing I want to say before getting into the great things that you're doing, in your 2.0 launch I want to just tie up everything we just talked about before. I just did a post which people you really loved on LinkedIn. And I didn't even coin this phrase. It's just something that is going around a lot. And a lot of doctors that kind of think like me are saying it. And that is, good doctors know how to prescribe medicine, okay? And great doctors know how to get people off of medicine. And that was something that so many positive responses, and a lot of them were not on the response section. They were all in my private inbox, and people were like, really, so many people were coming out of nowhere. I have no idea who these people were, but they were like, I'm with you. I can't agree with you more. But some of them just didn't even want to go public, with supporting certain things. So anyway, that ties up. But getting into,
I have to tell you,
oh yeah, please do.
The blog after I saw your post, because it was my 32nd anniversary of opening Wellness. And I included in my blog that LinkedIn post. I'll share the blog with you if you haven't seen it, embedded within my blog. And I'm getting people reaching out to me, not only from what I said in the blog and telling them I was going to be having this podcast with you today, but also saying, hands up to Dr. Sinicropi. I couldn't agree more. So I had to tell you that because I embedded your post within my blog because that's how much that resonated.
Thank you. I mean, I'd love to hear that. I'm just trying to get this message out. Again, it's just about being, I want to almost be a note taker. One of the things I was just talking about yesterday with a bunch of physicians is there are so many, now I want to be very pro, physician and researchers and all these people that are in traditional medicine that are doing groundbreaking research that can really change lives. And a lot of it is non-invasive stuff, but yet they are having trouble getting their message out because it's so noisy out here. It's almost noisy out here. So I almost want, through my podcast, through blogs, all these other things, I want to be almost their voice if they feel like they can't get the message out. Maybe I can say it in my Bronx style so that people understand what they're talking about and how revolutionary, those things are. And I know you do a lot of that stuff because you break down, in preparation for this, I watch so much of your stuff. You have an excellent style in breaking down complex topics so that the average Jill and Joe out there can understand what we're talking about. Because we do too, in the physician world, we do too much preaching to the choir. We go to these meetings, okay, present all this amazing stuff. We're talking to people. What is that going to do, right? We need to be talking to the masses and translating this information, right? Instead of talking to ourselves in that same room saying, oh man, that's amazing. This is great. Amazing. And then no one knows about it because we're bombarded by influencers that are trying to peddle some, drug they're getting paid for, to show or supplement or whatever. I mean, there's stuff that has science and there's stuff that doesn't. And whittling through that, you really need experts to do that. On that note, your stuff on this, the Wallace for Wellness 2.0 is so interesting, and it really is a culmination of decades of kind of what you've done and what you've seen, and so excited. And you seem like your energy levels are growing, because I watched some of your stuff from years ago. I mean, your energy level keeps going up, so obviously people should be doing whatever you recommend, obviously. Can you tell us a little bit about what is this new iteration, what is this new version of your program?
Yeah, so Wallace for Wellness, the clinic, the multidisciplinary award-winning clinic that I operated for 30 years, when I closed it 2 years ago, it was really so I'd have more bandwidth and time to do more what I call legacy work, education about integrative health and prevention, lobbying and advocacy work with government, to do like all the stuff we're talking about here, to create change in the way we approach healthcare, how we invest in prevention versus this pill for no, wait till it's broken, but get investment, helping corporations really have healthier workplaces, looking at prevention. And so I couldn't do that kind of work while still running a big clinic with a team, as much as I love it. And I love the hands-on work that I still do. I'm not treating as often anymore. I'm treating every other week, much to many of my patients' chagrin. There's a waiting list to see me. And I stopped taking new patients, which is also hard because many docs refer, and I find it hard to say no. But I know now that I've spent the 30 years or 32 years, now I need to take this to the next level. So what have I done? In the early days after selling Wallace for Wellness and launching sort of Wallace for Wellness 2.0, one of the things for the last 5 years that I was practicing with a clinic that I noticed, and I learned a lot in those treatment room walls and from the people that I worked with, naturopaths, massage therapists, physios, doctors, dietitians, all the people that I was learning from. I don't pretend to have all of their knowledge, but you start to absorb like a sponge and recognize when you can make a good referral because you know you're going to help that patient. But one of the things at least on the Health Canada website, and you have this in the US as well, I don't know where it exists altogether, but these awareness campaigns, which is important. If you've got diabetes or you've got cancer, we have campaigns to help educate and empower people with that. But there was something that was so glaringly clear to me, and it infuriated me, quite frankly, and that was this. There wasn't a single solitary day, week, month, or anything, minute about prevention. It was all about, and it made sense. I've existed in this space. So yeah, we wait till something's broken. We talked earlier about that opportunity gap. I live in the opportunity gap, helping people to try to prevent getting to that diagnosis. But it's not until that alarm bell goes off and you have the diagnosis, then, fortunately, when we need it, when I needed a surgery to have a nasal or a procedure to have a nasal gastric tube down my nose, I was grateful for it. So my bowel didn't rupture. Fair. But what about investment in prevention of that? And there wasn't a single solitary campaign. So I sat down at my computer after I sold the clinic, because I had time, and I told my health story, my own personal health journey. I told them my story of my clinic and how I grew it from the ground up and what it morphed into and my goal, and that I was now ready to be the founder and visionary behind the first ever, what I call Preventative Health Awareness Month and Movement. To shorten it, it's FAM. So for the month of February every year, Preventative Health Awareness Month, FAM, I was going to bring 50 healthcare professionals together from both allopathic and complementary medicine to bring them together to educate every day for a month online, completely free, different themed weeks, looking at the foundations of health, mental, physical, emotional, spiritual well-being, and then focus days, whether it be a bone health day, and I know we're going to talk about bone health soon, which would be appropriate, speaking to a spinal surgeon, mental health, and different ages and stages of life, because I believe we deserve to live well at every age and stage. And ageism exists in healthcare. So, and I have a soft spot for seniors, but I'm also internationally certified with infants. So I want to help that new mama and that infant that's struggling. But I said to Health Canada in this application that I was going to do this regardless of whether they got behind it in any way, shape, or form. But I wanted them to know that I would really love them to recognize this on their website. Then I sent out an email to over 100 healthcare professionals that are in my Rolodex from who I've worked with over the course of my 3 decades. And I told them my vision. And really that I wanted to bring everybody together and to do this free educational empowering campaign with posts and live webinars and special events to really stock the preventative health toolbox that the people we have the privilege of sharing it. And the focus was Canada, but we know online it goes everywhere. And that was in December that I sent that off. And in January, I was inundated with all different types of professionals saying, oh my gosh, Margaret, yes, I'm in. Yes, I will contribute. And then some were sending messages to other healthcare professionals saying, I want to be part of FAM, because FAM at the end of February turns into movement, because it's not about a 1-month campaign. It's not about a 1-month education. It's about a lifestyle and a mindset all year long. But we had to start somewhere. Do you know, Dr. Sinicropi, that the middle of January, I got a phone call from Health Canada. I almost fell off my chair. And they said, we got your application. We were very impressed by it. We think it's wonderful. Do you have a website? And the answer was, I had a website of my clinic, which I was still running, which I wasn't. I hadn't taken it down yet, because that was my identity for 30 years. And I said, no, why? They said, because if you have a website, and I had 2 weeks to do this, if you have a website, we will put it up on the Health Canada website in the Health Promotions Day alongside with all these other, and we'd be happy to do that. Well, I got busy and to work. And by the way, to this day, and this is year 2, FAM, join the family, get it? It's not funded. This was done completely through passion and purpose and tireless effort, and a few friends and colleagues that worked tirelessly. We got a website up within 2 weeks. It wasn't the greatest website, but we did it. It went live on the Health Canada website. It got media attention. And for 29 days straight, the first year in February, this year was a leap year, so it was a day shorter. Every day we had different theme days, and all looking at a topic. So we're diabetes, all different practitioners weighing in on that topic, that condition, stocking the toolbox of Canadians online, completely free with no funding. I almost collapsed at the end of February, and I'm still looking for funding, whether it be grant money, sponsorship, because I want to grow this. It is now growing. I now have a podcast and TV show called FAMcast, Preventative Health Awareness Movement. And we also, which excites me because this is going to help your mission, I'm working with an incredible team to create the first of its kind Preventative Health Practitioner Directory, where it can be scaled across our country and yours. And it has where it's be a database of not only what condition do you have. So if you have diabetes, what are the professionals that can help you with that? Because there's many ways to look at the diabetes and help support someone, as well as the area of expertise. So if you're looking for a massage therapist, or you're looking for a spinal surgeon, you're looking for a naturopath. So you can search different ways, but I'm hoping to grow this. And we launched it recently. There's only 15 people in it right now, but my goal, and it's got the infrastructure. I've spent a lot of money to build this infrastructure so it can handle the scaling, but we are ready to blow this up so that we can have a way for people, doctors to be part of this, but for patients as well, to be able to find people in their communities to become their integrative healthcare team. So that Wallace for Wellness 2.0, that was part of it. I know we're going to talk about the REMS bone scan. But the advocacy and education was the foundation of what the clinic did. And now in this next chapter of my career, I needed to have a movement that was going to be the launch pad for everything else. And one of those things that we're going to talk about is the REMS bone scan, as well as the corporate wellness programs and a portal, the CEO of Your Health portal, that's launching very soon, that's going to be accessible for everyday people to go and get everything from recipes and exercise and live, which I hope you'll be part of, live webinars with healthcare professionals, so they can be in the driver's seat of their health and take the strain off the system. I've met with politicians and have been lobbying for investment in prevention. I'm doing stuff like this, anybody that will listen. Yes, I'm still treating because it's hard not to, and I learn every day when I'm in a treatment room, but I'm also now ready to share broadly, and that's what Wallace for Wellness 2.0 is, sharing my tools and my life experience, but also my clinical experience and my ability to share in media, as I've done. I've got a media company that really produces education that is based on health and prevention. So that's sort of an overview. There's a lot to that and areas I think you're going to go into, but that's sort of what Wallace for Wellness 2.0. And I'm really excited, and we're just getting started 2 years in.
Well, you know what, you've got me really excited, and I'm very happy to contribute to your to the webinars and to articles and however else, and I'm sure that I look forward to talking to Canadians and Americans as well, and anyone else in the world that wants to chime in on these things. This stuff, I just want to emphasize to our listeners. I mean, they hear me ranting all the time now if they follow me on social, but it is so important, the mission of what you're doing. And it's interesting because sometimes it just seems like it's just one of those things. It just seems like, oh, obviously, obviously we need this stuff. But you know what? A lot of times should be obvious, no one's doing it. People are just not doing it. And I had an opportunity to look. I love the idea of the directory, because that is one of the things. When you have a directory that is a vetted directory, I think it's going to be a lot more effective than whoever is able to outmarket each other on, because, right, there has to be a way to just kind of vet people. Yes, sort of kind of how like Angie's List works and things like that. I mean, it is amazing. And obviously, the Angie's List, it's okay for wellness stuff, but not really. I mean, I've looked at some of the stuff on there. That's not really what it's designed for. So I love what you're doing, and hopefully we can build something like that down here in the States, and happy to, to help on that front. Just brilliant. I love that idea. And so let's get into this REMS bone scan. Okay, so for the listeners out there, our clinic, we are a spine surgery clinic. We see tens of thousands of patients. I mean, we're a very, very busy center, and we have referred. I don't even know. We should look and see how many DEXA scans we've referred out to. Because from when I started, we have a physician, Dr. Glenn Butterman, who has written a lot. He's a very well-known author internationally, and one of his passions is actually osteoporosis. And so, unlike some other centers, our clinic does a lot of work with osteoporosis. But to be honest, I mean, we do use some newer modalities now, but the DEXA scan has been obviously the go-to for us. And so REMS is something it's newer, a lot newer. And it's kind of the new kid on the block, but it may be superior in many ways, including not having radiation and a lot of other things. So this is something that's definitely new to me, and something that we are going to be investing in and doing this REMS bone scan. And thanks to you, it's something that you put on my radar. I've seen little things out here and there, but it's just not something, because we have DEXA scanners all over the place here in Minnesota. There's DEXA, in every street corner. A lot of that's being done. And so why don't you tell the listeners, first of all, before we get into the differences between the two, now there's a reason that using the word, the acronym REMS is nice, because it's not that easy to say it, and it's easy to slip up. But can you tell us what REMS is, and something about how the technology, that ultrasound technology, works to make the diagnosis of bone health?
Stands for radio frequency echographic multispectrometry. Yes, it's a mouthful, and it's ultrasound based. And you're right, it's the new kid on the block. And it was brought to me by a good friend and colleague who's a medical sonographer. Her name is Megan Burmester from Osteosound. About a year and a half ago, when she saw that I had sold my clinic and she was instrumental in being one of the people. She didn't bring it to Canada, but who wanted to bring it to Canadians. This ultrasound-based, more comprehensive picture of bone health, because not only, similar to DEXA, does it look at T-score or bone mineral density, bone quantity, but this device also looks at bone quality, bone strength, and as a result, the fragility risk fracture score. And thanks to the research that coming out of Italy about fragility risk fracture score, we're saying that they're saying that in fact, it's not quantity of bone or that T-score that's the best predictor of whether you'll fracture due to osteoporosis, but rather bone quality or that fragility risk fracture score that we need to be focusing on. And the DEXA does not give that fragility risk fracture score. So the benefits of REMS, there are many. First of all, like you said, there's no radiation. We've talked ad nauseum, and it never makes me sick, about prevention. What's so unique about this technology as well is that it's 21 and older. So we can start much sooner. You know, as a spinal surgeon, that peak bone mass happens in and around the age of 25 or 30. But, you know, in Canada, we don't qualify for a DEXA scan until we're 65, unless we're considered high risk. But often bone health is silent, and we don't know that we're high risk until we fracture, and then you're sent for a scan. And once again, then we're trying to work from a place that's already broken. Whereas if we take the REMS earlier and we start to do these analysis younger, and we have a way to look at comprehensive picture of bone health, both the T-score as well as the bone quality and fragility risk fracture score, it can be instrumental in helping to create treatment plans, helping patients understand what's going on with their musculoskeletal health, which motivates them to get into action and prevent things, catastrophic things. And it's also, Megan and I from OsteoSound have partnered because we're on a mission to change the dialogue and the narrative around osteoporosis. Whether you are a 30-year-old or an 80-year-old, if you have a minus 2.5 standard deviation or greater T-score, you're going to be told you have osteoporosis. And typically, the standard of care is that you're going to be put on a bisphosphonate. The 25 or 30-year-old versus the 80-year-old are two very different people, but they're lumped into the same bucket, and there's decades between them, and that opportunity gap is very different. And bone quality, which is so exciting, we know that lifestyle changes can impact bone quality. We know we lose bone as we age, and yes, can we slow down bone loss, the quantity of bone loss? Yes, it's harder to do the older we get. But bone quality into your 60s and 70s and 80s through lifestyle changes, when you get into the driver's seat of your health, we can not only slow it down, but we can improve. And the REMS scan actually shows that improvement because it's more sensitive than DEXA. There's less errors. So people can come back after 6 months or 8 months or after a year and actually see their improvement. How motivating is that? And over the course of the last year and a half, Megan and I have seen, Megan has scanned over 500 patients, and we are partnering because I'm bringing the educational and preventative aspect of this, the consultation, the preventative health education, which is critically important both for the patient and for the practitioner who's going to be doing these scans, or if we're taking REMS on the road. That's the other benefit of REMS versus DEXA. Doesn't have to be in a room, you know, there's no radiation, it's in a suitcase. It can be taken on the road. We take it to clinics. We've done it in corporations. It can be done anywhere. It is powerful. And I truly believe over time, this is going to become the go-to standard of care. Will it take time? You bet it will. But I'm up for the challenge because the number of people, the lives that we're changing in the last year and a half, the tears that are flowing in our treatment rooms, the empowerment that's happening with people that are getting their scan and being shocked. And conversely, too, the DEXA can make people, for example, with diabetes, we talked a lot about diabetes, look better from a T-score than they actually are. Because sclerosis in the bone can falsely elevate and look like the T-score is great. And then they come and see us for a REMS. And actually their bone quality is horrible. And they have got a high fragility risk fracture score. And they didn't even know they were at risk of a fracture. Or in seniors, we're taking it into seniors' home. prevention of falls and fractures that are catastrophic to the longevity and the health of the individual. But more importantly, it also impacts the bottom line because it's expensive when a senior falls and breaks their hip. We can create care plans that are different because we know that Mrs. Smith has a high fragility risk fracture score, even if her DEXA perhaps didn't show that she had a T-score
Yes.
that was saying she had osteoporosis. So this is really exciting, and we are just getting started. I'm learning so much from many healthcare professionals around me. I want to give a shout out to Dr. Andy Bush and Dr. Kim Zambito, other orthopedic surgeons in the US that I've done some learning from as well. But we're just getting started, and this is an incredible tool. And here's the other thing: it can be self-referred. It's accessible to the average person. There aren't long wait times. It's not financially prohibitive because it doesn't cost tons of money. But the money you're going to save in wellness because you're going to be living better is remarkable. And I hope that gave you sort of an overview.
I mean, we can get way into the details. Obviously, every time I put my science hat on, I looked at all these numbers and everything like that, because any newer technology to myself, I've got to read all the studies and look at it. There's a great European study that they did, which looked at a lot of patients and showed good sensitivity and specificity for picking this up. I love the fact that it not only the nice thing is, from my understanding, and I'm actually going to do a post on this, hopefully in the next week, with all, like, really getting into the science. I really want to get into the science for our crowd, but also for myself, because I obviously this is something we're going to be using. You get the bone quantity so that you can still get a T-score. You still can compare it to their old DEXA, but then you get this whole other new thing, which is the quality, which is that fragility score. And it's nice because even if you have a higher T-score and you're concerned, especially in some of these younger patients, their bone quality might be reasonable. So you're absolutely right. It may change the way we make that decision to put them on medications that also have a lot of side effects, which may then change the trajectory of their lives in a different way. Although there's some great stuff out there, and the nice thing is our clinics, we have a lot of experience with medications and things like that, and we use the Forteos of the world and whatever. Again, this is not, I don't want to get down that road, but from a health and prevention standpoint, the reason I really love it is because it gives more data. It's easy to use. Obviously, there's going to be some operator, learning curve and things like that. It's an ultrasound. It's like anything else. You have to get the hip just right, and then L1 to L4, which is what we're looking at. But once you get that data, if we can make it an effort to scan people younger and younger, because it's a well-known thing that people are coming down with osteopenia and osteoporosis much younger because of the way our lives are our lifestyles, then we can do all those things that I love talking about. We can make those dietary changes. We could look at protein, vitamin D, the calcium levels. We can make sure they're getting their 1 to 1.2 grams of protein per body weight, which is really, really important, unless they have kidney disease or other things. Again, we're not here for personalized treatment. We're just here for a general overview of all of these things. But the fact is, it gives us just a different way of thinking. And from what I've seen, I see people younger and younger that are coming in with bone issues where they're osteoporotic, either at least osteopenic or osteoporotic, frankly osteoporotic, and they're young. They're patients that are, in their 40s, and we're not expecting it. But now for certain, types of patients, I'll refer them. And again, I've still been using the good old DEXA scan, but we are picking up some very concerning things, because my concern as a spine surgeon, I don't want to put in screws into Swiss cheese. And so that's why. But if I wasn't referring them for a DEXA scan, it might be 15 years before they had a DEXA scan. And you know when they're going to have it? When they come in with 3 compression fractures, when they sneeze. And that's not the right time to be really evaluating these people. So I think we need a massive movement. And thank you for pushing this so hard. I think we need a huge movement in bone health, and really getting that message out so that we can do all of the things to reverse it. And really quickly, I put some information out there on LinkedIn. It's interesting. And that came from another physician I was talking to who's been doing bone health for a long, long time. And that is, he looked at all of these younger women that would have never gotten scanned. He just said, hey, I'll just do free scans. They're in his building. He's a physician in that building. He had a DEXA scanner. He said, you can all come. Everyone could. It was, he was even shocked at how many of these younger women had either, most of them had osteopenia, actually, like a large percentage of them. He was shocked. All he did was put them on a resistance exercise protocol and sit them on a pulsed electromagnetic frequency mat for 1 year. The change in the DEXA after 1 year was dramatic, dramatic. Okay. And again, this is just anecdotal. He didn't write a paper on it or anything, but though hearing those stories as a physician, I say, man, we really need to be scanning these people way earlier because, as you know, the disability that we have from osteoporosis and all these fragility fractures out here, we see it every day. I mean, we take care of a level 1 trauma center and a level 3 center all day, every day, all day, every day. Fragility fracture after fragility fracture. Now they're calling us, the vast majority of them don't need spine surgery. Sometimes we'll do vertebroplasties, things like that. Most of them, it's just a brace and send them to an endocrinologist or things like that. But most of these are all it's all preventable. It's all preventable. Like most of the people in the ICU, most of it's preventable. Who's working on it? So
about prevention, I think it's important. A couple of things that I'd like to raise. First of all, we know that the DEXAs can have errors, calibration errors, positioning errors if you're going to the same machine the same time. It also skews negatively to a lot of smaller boned women where REMS shines in this regard.
Yes.
This a lot, these smaller boned women that come in and their bone quality is excellent, but their T-score is minus 3.0. And they're being pushed very hard to be put on harsh medications that may or may not be necessary, that can cause side effects. And that's another whole show within itself. And the tears, and they're petrified. There's this fear around this diagnosis. They're being told, don't lean. We had one in our clinic yesterday. Don't lean over to pick up a paper on the floor, or don't twist because you're going to fracture, and you're going to be in a wheelchair by the time you're 60. Meanwhile, their bone quality is superb, and the REMS doesn't skew negatively against small boned women. It has less errors, and for the viewers, I think it's really important for you to know that we did the Global REMS Symposium last year, and I think it would be something that you might want to tag in your post, where we sat down and we really went through DEXA and REMS. And there's a place for DEXA, and we should be comparing REMS to REMS and DEXA to DEXA, but you're right, there's a place to cross over. It is different type of technology, but when we have the ability, like you said, to scan earlier and to get bone mineral density and bone quality and have a visual that enables patients to realize, oh, well, hang on a minute here, I can get into action. And that's what this portal is going to be about, so that people can then, well, what does that look like? What is the nutrition? What is the modalities? What are the exercises that I can do? It is a game changer. When we think about all the underlying conditions that people don't even realize their bones are bad, asthmatics, people think that osteoporosis is an old person's disease. Well, no, in fact, quietly, and this is where I'm passionate, musculoskeletal health, and that's what I've worked in my whole career, is the foundation of all wellness. If we don't have a strong musculoskeletal system, if you can't move, if you don't move, you can't move, and if you can't move, then we've got cardiovascular issues and immune issues, and it's a cascading effect of trauma that ends up happening, and people's lives and longevity, the quality and longevity is completely diminished. And that's what's been so rewarding, and I believe is our secret sauce. We're not just scanning people and sending them on their way. We're scanning them, we're educating them, we're empowering them, and we're stocking their toolbox. That's what OsteoSound and CEO of Your Health is doing to change the narrative when it comes to bone health. And that's why we're excited, and why I reached out to you about REMS. You didn't know about it prior. And this is an option to consider, and patients need to know that it's an option to consider. And here in Canada, there's long wait lists to get DEXAs.
I mean, that really, thank you for putting that on the radar. That is not something that is anywhere near readily available here down in the States. And like any of the other technologies that, I kind of very proud to put my name behind. Now that I've done the research on REMS, it is an and have watched, not only kind of your stuff, but I've seen a lot of orthopedic surgeons out there talking about it. So I've watched a lot and I've read a lot on REMS, and I could not be more excited about bringing a technology, again, non-invasive, great studies behind it, no radiation. It's like, why would we not do that? And what I want to really stress to the listeners, those of you that have not either yourselves or through family members experience the ravages of osteoporosis, I can tell you it is a complete disaster. I can pull up a text right now. So my first, kind of text of the morning yesterday was one of my colleagues sending out the images of an older lady who her spine was literally bone dust, fractures everywhere. And the question was, do I even try to do a surgery on this? And it was mixed, it was kind of like, I don't know, because it is such a disaster. And we know it's so difficult. The options are either try a heroic surgery to put her spine back together. Okay, because when those patients fall, I mean, they literally break. I mean, not break. I mean, they break. This lady was broken in so many pieces. It's heartbreaking as a surgeon to look at it. When surgeons look at your stuff and say, "Ooh, that's not what you want," right? And so I want people to understand that if we can make a dent in the education, the scanning, the early scanning, and then take action steps to make changes in the world of osteoporosis, it is so dramatic. I know those of you out there that have family members that have fallen and broken a hip or have multiple spine fractures, or you yourself have these fragility fractures. It literally changes your life. I mean, it's such a negative impact on the quality of life. And first of all, the mortality rate in elderly people after a hip fracture, after 1 year, not good. Not good. And so it is just such a disaster. And so thank you so much for being at the forefront of this. And I think that it is something that I am so excited to try to be more on the, not on the, on the wellness side, on the prevention side. Because again, traditionally surgeons, we are on the fixing side. We're not on the prevention side, but we all need to be, or not everybody, but at least enough of us that we can make a dent in millions of people's lives. Because this isn't like a couple 100,000 people have osteoporosis. This is millions and millions. And I actually put out the statistic on a previous post that I did. It's a massive, massive problem.
And Dr. Sinicropi, I said earlier that things have happened to me in my own health that has really led me down the path of the work that I'm doing. And this is no different when it comes to bone health. My mother, an amazing woman, 81, has osteoporosis, but it wasn't until she had the REMS scan that uncovered her high fragility risk fracture score. Her bone quality is horrible. Now, she is a tiny little woman. She's a firecracker, not one to take a lot of medications, exercises, does all the things, but she's had some underlying conditions that has contributed to her bone quality, and medications that have not helped her bone mineral density and bone quality. But it was the REMS when Megan scanned my mom, and not only did she have a high, or her T-score was clearly osteoporotic, her bone mineral density was not good, but her bone quality was in the red. And it was, she's got bones like butter. And a year ago, February, she hopped up, the fact that at 81, she could get up on a countertop in her kitchen to get an ice pack because her knee was bothering her from doing a minute plank the day before, but missed the stool and fell 3 feet and had 2 compression fractures, vertebral compression fractures. I witnessed as a daughter, forget the therapist, the excruciating pain that my mother went through. Now, thanks heavens to an incredible interventional radiologist and friend, Dr. Christopher Guest here in Canada, brilliant man who I want to introduce you to. He did my mom's 2, not 1, but 2 vertebroplasties, and she's living independently at 81 as we speak, but is so aware now, and thanks to REMS, is aware of the fact that her bones are like butter, but every day she's using her Meradyne Live vibration plate, which is another, that's a Health Canada approved class 2 medical device here in Canada, based on the research that NASA did with astronauts in space. So my mom stands on her vibration plate every day to help build those osteoblasts. She's using her supplements and taking her magnesium and K2 and she's using the dolphin that we were going to talk about. She's doing her PEMF. She's doing all of the things because she's chosen to not take the medication because she tends to have horrible side effects from meds. She's 81, but she has an awareness now that when she goes outside, she's not going if it's really slippery. She's very cautious about how she conducts her life and is actively doing things to prevent, but with her eyes wide open. And that was thanks to REMS. So once again, in my career, it parallels my life. And here, technology showed up and the opportunity to collaborate with OsteoSound and then have, be fortunate like Dr. Guest to be able to help my mother. And now I want to be able to help others because I know what my mother went through. And as you said, it's catastrophic and it can be, but we can prevent early.
Absolutely. I mean, so many, again, and this extends, as we get into your, the CEO of the Health Hub, and I'll just let like all the guests know, we could talk about osteoporosis, DEXA, REMS, FRAX, sensitivity, all this. We could get into the weeds. It's a 5-hour show. And so we'll do more stuff in the future, specifically on bone health, and maybe give a bunch of tips on not only how we diagnose it best, when people should go in for these things, and then also dietary planning, lifestyle changes, avoiding toxins, and on and on and on, because even the toxins, and even drilling down to, everyone knows my favorite, mitochondrial dysfunction, which also plays into this, because if your osteoblasts have mitochondrial dysfunction, they're not going to be working so good. So there's so many ways to approach this problem. But what I'd like to say is, osteoporosis, like the other buckets of things that I like to talk about on my channels, okay, diabetes, obesity, autoimmune diseases, brain diseases, all these things, a vast majority of them are absolutely 100% man-made illnesses, and we really need to work together to tamp down on them. Number one, because it's the right thing to do, and it's going to help people lead a lot better lives. Number two, our healthcare systems are going to buckle under the pressure, and we are going to have to start rationing care because it's just not doable. It's not doable. I am telling everyone, it's not possible. People think it's possible. There's only so much sick care that we can do. Eventually, it's just not going to work out anymore because we're going to be completely bankrupt from all these sick people. And not only that, who wants to live in a society where everybody's sick? That's not the happiest society. When you think about happy societies, we don't think about a sick society. And honestly, we're a sick society. We spend a lot of money on our chronic health care, and it just keeps getting worse. So clearly, we're not doing it well, and we need to change direction. And so, on that note, the CEO of your own health hub, again, I love that. CEO of your own, that is really what people need to be doing. And so tell us a little bit about the hub, what you're going to be offering there, what your long-term, vision is on that, and kind of what the future looks like.
Yeah, I'm really excited about this. And this has been a long time coming. We have what's called a learner management system, an online portal. And I really was determined to create an educational online hub that would not just look at bone health, but of course, musculoskeletal health is right in the wheelhouse of my passion. But this whole idea of integrative medicine and helping put you in the driver's seat of your health, all things are interconnected. So this educational hub consists of a whole self-care toolbox that will be full of all kinds of things, from tips from a nutritionist, recipes that are quick and easy to do, exercises related, whether it be weight-bearing activities or whether it's stretches or mindfulness and mindset education. So there'll be the on-demand content, and I've deliberately chosen to do something a little different than what's currently out there. From my years of experience running a clinic, what I've noticed in terms of human behavior is that when people have a lot of information at them and you tsunami them with all kinds of things that they have to do, program that's extensive, and don't get me wrong, you want to give them many options to consider when it comes to their health, whether they're coming for osteoporosis treatment or whether it's depression. You want to give them options to consider. But here's what I know clinically from my years running Wallace for Wellness, and that is that if you give too much to somebody all at once, and regardless of how much they pay for it, analysis paralysis, human nature, people start to, and they don't do anything. They freeze and they do nothing. And then they feel bad about themselves because they spent this money on this program that might have cost them $12,000, and they failed at it, or they didn't finish it, or they couldn't get started, or they were overwhelmed and they were stuck. What I want to do in the crazy busy world that we all live in is to bite this elephant one piece at a time and deliver educational evidence-informed content in a way that people can literally digest it a little bit at a time so that they can then implement it rather than just be worried about getting it all done and having to do this. And we're going to do that in different ways. On-demand content, at your pace learning, at your fingertip in the comfort of your home, where you can take a workshop or an online module that's specifically about bone health, or maybe you're going to be doing an entire exercise stretches or what have you. But then we're also going to do live webinars because I want to create community where people feel heard and listened to, so that when we do a live webinar with you, Dr. Sinicropi, and people come on, they can ask you the questions. We can have dialogue and people can feel heard. Those will also be recorded and in the hub, so you can watch it if you can't be there live and on demand. And then there's going to be more in-depth courses where you really want to see behavioral change, not quick, easy, bite-sized pieces, but where you want to track progress. And we're going to start to build on that. So initially, we're going to have the toolbox with some shorter tidbits of education and information, PDFs, depending on the type of learning style you have. Maybe visual learning, you want to watch a video, but then you want to have a PDF to read, or you want that recipe to print off. We're going to make sure that's available. And the the live. And then, of course, we'll eventually, with our community, be having events where we're going to be holding FAM events, Preventative Health Awareness Movement events, where we bring people together in a big space, where almost like a wellness bell ringer, where you can go around and meet these different practitioners and experience things that we talked about in the hub, the items that that we talked about and the science behind it, but now you can touch and feel and experience. This hub is meant to layer your tools and your toolbox, to put you into action, to make you understand and learn at your pace, and most importantly, for it to be accessible to the average person, meaning monthly cost that's reasonable, where you can get access, but you feel like you don't have to cut through the noise that you've talked about. Is that you're going to know that the people in this hub are vetted, and that you're going to be getting information that we know is safe, and where you're going to be able to pick and choose and create your own team and the way you want to approach your health, so you feel empowered. Because I truly believe, and you'll see this on my website, the everyday person is the most important member of their healthcare team. So this hub is going to help them to do that. And then, of course, they'll have access to our blog, which has got all kinds of free content, and our podcast and television show that airs here in Canada, and other ways that we'll be making sure we give education for everyone, so everyone has access. Does that tell you about the hub?
I think that's a great answer. What I love about it is I like the idea of kind of consolidating everything under one thing, having different access. But what I really like about the concept is that people can feel like they're this. I mean, it is. You're the CEO of your health hub. It's like when you're doing that, you're empowering yourself to see what's out there. That doesn't mean you're going to use every tool, but you've got access to these different tools, which is a lot easier than, for example, putting in, I've got diabetes, and clicking Google and you could look, I tell patients, like, even for spine stuff, I'm like, you could look, 1,000 pages are going to pop up. How do you sift through that if you just don't even know where to start? And then you get the analysis paralysis, and then you end up doing nothing, or it's like, it's too I don't want to do that. Just the usual stuff. You start making all those excuses, and it's too hard, it's too whatever. So making it easy for people, but also having access to live webinars and different types of, not just, things they could use, modalities, but people. They have access to certain doctors that are part of the platform, and nutritionists and therapists and mental health specialists, on and on and on. So love what you're doing, just absolutely love what you're doing. As our time is starting to kind of to run down, what I'd like for you to talk about are some of the things that I know that you kind of have with you right there in front of you that they can find in the toolkit. I go in really simple to use things. And I could tell you in my life, without getting into the stuff we use, I mean, we have specific, our family uses certain supplements, and we have certain things. Obviously, we're big into red light therapy. We have all these things that we do as a family. Everybody's different, but having all those tools in the toolkit are great. So can you just talk about some of the things people might not be as familiar with? Because you put me on some of these things as well that I wasn't really familiar with.
Yeah, and I love that. And I want to make it clear that in the hub, there's going to be stuff that are literally at your fingertips, so that doesn't cost you any money, meaning like tapping and showing you the science and the research behind it, and then a master facilitator to show you how to do tapping for pain and mental health and all of the things. But then there's going to be some things, like, for example, this incredible device that I've been highly trained in for years. It's called microcurrent point stimulation therapy, or the name of the device itself is called the Dolphin. This has been a game changer, not only in my practice, but in my day-to-day living and in putting it in the hands of my family and patients, because this is a Health Canada, FDA also approved device for people to use at home. It takes needleless acupuncture and microcurrent and combines it. Now, not microcurrent like a typical TENS machine that is alternating current. A TENS machine is alternating current. But this is direct current that mimics the current in the body. And then following the principles of acupuncture, what this is very helpful in doing is down-regulating the autonomic nervous system. Research and studies have shown it drops cortisol, our stress hormone, which is a huge impact on many aspects of health. You know, we can go on, cortisol is a hormone I talk days. But it also comes with a protocol book, almost like a paint by numbers. You've got, because the nervous system impacts every aspect and every system in the body. So whether you have depression, or whether you have back pain, or maybe you've got neuropathy or a Bell's palsy, or perhaps you've got concussion, or maybe you've had surgery and you've had your hip replaced, and we're going to use 2 units. Now, you would see a therapist to do this, but scar release, it's a game changer. And what it does is it literally changes the polarity of the cell, down-regulates the autonomic nervous system, puts you into more parasympathetic state where healing can occur, drops cortisol levels and inflammatory markers. But what's beautiful about it is everyday people can use this. This sits on my 81-year-old mother's coffee table, and she uses it daily for pain during COVID, for anxiety. I'm using this with children with sensory issues or anxiety. It's a game changer. And then during COVID, I happen to know the doctor of acupuncture that created this device, and I've been highly trained. And I want to give a shout out to Kelly Armstrong. She's an American occupational therapist who I did a lot of my training with. She's a brilliant woman. She's out of Florida, and she's been involved in a lot of the research. During COVID, they came up with this attachment, and a game changer like no other. So you made reference to the vagus nerve earlier in our conversation. For those viewers that don't know what the vagus nerve is, the largest nerve in your body, running from the brainstem, wrapping around the mastoid process in front of the throat, all the way down to the gut where it serves the organs. And what we know for a very long time in allopathic medicine is that if we can tonify the vagus nerve, we can decrease inflammation in the body. If we can tonify the vagus nerve, we can decrease pain. The problem is, how do we get to the vagus nerve? And there's things you can do on the outside of your body, but this attachment, along with the grounding pad that can be put at the bottom of the vagus nerve, below the umbilicus, the belly button, or on the wrist, and clipped on a patient's ear passively, it is a game changer when it comes to having an impact on the vagus nerve. And what's actually shown in COVID long haul, there's a protocol for COVID long haul. And I've personally, as a therapist, seen incredible results. Neurological neuropathies, pain management, scar release, emotional trauma. I've got psychologists using this during treatment with trauma work for that somatic issues that people have in their body to release emotion out of the body. It is a game changer. So we're going to do education about this. A lot of insurance companies cover this because there is a cost to it, but we can also show acupuncture points and acupressure in the hub you can do with your fingertips that cost you nothing. The other thing I wanted to show really quickly, and this is called spike technology. This is a mat. It looks like a regular rubber mat, but oh no, it's got over 50 global patents. Comes in different sizes. There's also a seat cushion, and now also comes in an insole. I know the Canadian inventor, shout out to Brian Jameson. These hundreds of nubs move in 360 degrees and diffuse pressure over a larger surface area. Ergomorphology, you'll see how they're all interconnected. They've done some Doppler testing and seen increased blood flow. It acts as a shock absorber. But as a therapist, why do I love this technology? It's accessible, it's inexpensive, it can be used in healthcare because it can be washed. It's closed cell foam, so you can wash it and disinfect it, but it has a multitude of uses. Amazing for proprioception and falls prevention in seniors, balance activities and trauma. My mom uses this for balancing exercises every day to prevent falls. It's great for preventing plagiocephaly, flat head in children, neuropathies, and foot pain, unbelievable. Laying on this under your sheet if you've had surgery to increase circulation. If you're a menopausal woman and experiencing myalgia in your hips, you sit or stand on spike, it's a game changer. If you're sitting at your computer or in your car, I can go on and on. Proprioception and neuro retraining. And what I love about it, it's inexpensive and accessible, and it can be used at home. And then lastly, like you said, I love to give access to many different types of things
Yes.
and people can have options too. But I really do my due diligence. And there's, for example, we're talking about bone health and supplements. Magnesium 5X, this is actually a Canadian company. I know the holistic practitioner that created this and the organic farmer and soil scientist in the prairies that have created this. And I've sent you some of these, Dr. Sinicropi. But magnesium 5X, 5 different magnesiums, bioavailable. This has been a game changer in my health. I was on a very good quality magnesium bisglycinate. And when I was starting to have muscle cramping again in menopause, when I started to take magnesium 5X, game changer. Selenda, there's a lot of research on humic fulvic acid and absorption and inflammation. And then mitochondrial and bone and thyroid support, kelp, and other things that are in this product, game changer. So we can go down that rabbit hole when we're talking about energy and mitochondrial function. But this is not a sales pitch. This is stocking a toolbox. And there'll be lots of other things so that you are more informed in health esteem, so you can ask better questions, regardless of what supplement you use. You're more informed to be more curious and judicious instead of just taking what somebody tells you is good. You have the knowledge through this hub to then make informed decisions for you and your family of what tools you're going to put in your toolbox to help you and your family live.
You said it best. It's not, you have so much energy and you're pushing, you're talking about these things, but it's more as far as generic. So I just want to unpack it just a little bit because again, you're opening up this can of worms. Number one, on the vagal nerve stimulator, I have one of my good friends, he's actually a physician. He uses a vagal nerve stimulator every single day. And there's different ways to stimulate the parasympathetic nervous system. So for our listeners, these are hacks where we are trying to basically put the two nervous systems in balance, and that's parasympathetic and sympathetic. So the way we live our lives, and we always talk about wellness, we're living at the speed of light. And so we are constantly in the sympathetic fight or flight state, and we are flooded with these hormones of stress, which are a complete disaster for our bodies. On the other hand, when we're living in the parasympathetic system, which the vagal nerve is in that system, we are flooded with what we call the hormones of love. And again, this is something I've posted about. I know it sounds fluffy, but that's just what it is, unless people want to talk about the hundreds of metabolites that we see. So other things that put you in parasympathetic state, breathing, breath work, meditation work. I had Dr. Sunder on the show that was one of the chief scientific officers for a company called Newcom, where it's these binaural beats that put you into parasympathetic state. And that's been heavily studied in the military. This vagal nerve stimulator that you just showed, think about it. It's FDA cleared, right? And it's approved in Canada because we want to be in parasympathetic state. And to be honest with you, because we're moving at the speed of light, it's a lot easier for people just to clip that on their ear and do all those other things than it is for them to go, like actually Dr. Sunder said on the show, to go into the caves of India and meditate for 3 hours, right? So we are looking at these biohacks. And the funny thing is, it's not a pill, it's not an operation, but guess what? It's science. It's just plain, it's just as much science as the operations that people let me do on their bodies. It's science. It's just science.
Heart rate variability, critical. And this, we can put this into your hands. And here in Canada, like I mentioned, many people have extended health insurance coverage. And now I can show them what they can be using and doing this at home. Changing heart rate variability, which is a critical component of our health. You're absolutely right. It is scientific, but this is why I love to come on and share. And that's what this hub is going to be full of. And breath work is in there as well, and meditation, and all the things, but bringing both sides of that equation. So coming full circle in our conversation, bringing allopathic, complementary medicine, and the everyday person together in a hub to stock your toolbox with evidence-informed strategies, tools, tips, and hacks that you can, and here's the neat thing, it's also integrative. So you may come in because you have osteoporosis and you want to learn more about your bone health, but all of a sudden you're learning other things that you're realizing these professionals are saying, oh, by the way, this is going to, because they're all interconnected, this is going to impact your gut health. Oh, and now my friend's got gut health issues. There's not a hub out that I'm aware of out there yet, and that's what I'm creating, that's looking at all the systems together. And it's not just for bone health. And don't get me wrong, it's good to have programs that are specific to that.
Sure.
But bone health is not just about the muscles in the bone. It's your gut, it's your hormones, it's your stress, it's your sleep, it's all of it. So regardless of what brings you to the hub, you're going to learn skills and tips to help that, but you're also going to open your mind and change the mindset, because you might find things that might help you. Maybe you're not in menopause yet, but down the road you are, and you will, I remember I did that in that hub and I can go back. And by the way, this hub is going to be very accessible and not expensive. I want to do a monthly amount that's really reasonable for the average person. And I'm lobbying to have it covered through extended health insurance here in Canada, because once again, where are we investing our time and our money? If we could take the amount that we're investing perhaps in pharma and give a little bit of that to education like this, so the average person can feel more empowered, so we're not ending up in your surgical suite. That's what I'm here for, and that's the role that I want to play in partnership and collaboration with people like you. So I am so honored, and so thank you so much for having me. I just can't get over how my wheels are turning, because I can think you're going to come on my podcast too, but I got to come back because there's so much more to talk about.
No, there's I mean, I think we unpacked, there is absolutely so much to talk about, but the exciting thing is that people, in a sense, are going to start waking up, even if we have to sit on their head to wake them up, because we just have to bang down the door, because it's, you know, the thing that bothers me so much about when I talk to people, I talk to patients or just people in general, is when they're apathetic about health and prevention. I'm like, and the reason it's bothersome, I'm like, it's you. I'm not talking about myself. I'm not boring. I'm just saying, hey, you know what's going on in Dr. Sinicropi's life? My kid's playing soccer and my other one's running track. I'm talking about you. How in the world are you not interested about you? And I get it. You might be young. You might be, quote unquote, okay for now, even though all the signs are there. And I see it as a physician. I'm like, all the signs are there. Give you 10 years, you keep living like this, you're going to be a broken person. But that apathy, that give up, and then that other apathy, and then that's the apathy of not even caring. And then when they get sick, the giving up. Oh, there's nothing to do. It's just this way. I'm 52. That's it. Everyone at 52, we're just sick, right? I'm old age. I'm like, what with the things that we have available for health and prevention, and now that we have done such a good job solving a lot of the infectious disease issues that used to kill us 100 years ago, right? Yep. It's like we're living longer, but we're living sicker and sicker and sicker. And it's such a big burden. And so that apathy is so bothersome to me. And again, there's so many things I want to, talk until I'm blue in the face, about. And that is one of the big ones. And thank you for being such a great spokesman for these issues and picking up that torch, despite the fact that I know that we didn't even talk about all the things that you've had to overcome, I'm sure, early on in getting the message out, but it's working. Listen, you have your own month, for God's sake, in Canada, right, where they're recognizing this. So we need to work on making February also a health recognition month here for prevention and health in the United States. That's a whole other idea. Other than that, I think this has been really a tour de force. I love talking to people like you that are so invested in this. And to be honest, listen, you've been doing this for 30, and this is what I'm finding with so many of the guests I've had on the show. People have to realize most of the people on you don't have to be doing this. You could just be doing anything. You could just be going on vacations and hanging out. All these other, people that I've had on the show, they don't have to do it. People are doing it because they're so passionate about helping their fellow human I think it's infectious. I think I can't get more energy from talking to people like you. And every time I get around people like you, it makes me want to do more. I just start thinking, how can I cut my sleep even more so I
You know,
can do more?
go
I
do
know,
that.
I know. I talk about sleep all the time. I know sleep hygiene. That's a whole other show. But anyway, how can I get more from my hours so that I can be even more productive so we can spread the message even more? So again, thank you so much for coming on the program. I think our listeners are going to absolutely, there's so much to unpack from this program. The last thing I want you to let our listeners know, and we'll have this also on the screen so everyone knows, let the listeners know and the viewers how they can find you, all the different ways they can find you, what the preferred ways are, and just want to make sure that access to you because you just have such a great wealth of information to share.
Thank you so much. And what a pleasure and honor. I really am. I'm very excited to be crossing the border and linking arms with our friends south of us, because this is a big mission that we're on together. And the more we link arms, the better it will be. So, and I think what I want to make sure we do is breathe belief into people that it's possible, that you
Mhm.
don't have to be your story, that this doesn't have to be the case. And we're here to breathe belief in. So any way that I can help, I'm here to do it. So wallaceforwellness.com, WALLIS for FOR wellness.com, or you could become the CEO of your health.com or .ca. Those are the two URLs to the website. And we're actually splintering off another website soon for Preventative Health Awareness Month and Movement, because we want to make sure it's clean and easy for navigate. Social channels, you can find me, Wallace for Wellness on Instagram, the number 4 Wellness on Instagram. It'll say become the CEO of your health. On LinkedIn, I'm there as well. On Facebook, become the CEO of your health. You can join us there. Make sure when you go to wallaceforwellness.com that you subscribe and join the family, subscribe to the blog, and get on the waiting list for the CEO of your Health Hub, because when it launches, the people that are on the waiting list are going to get a discount. And I'm telling you, it's not going to be a lot of money to join this, but we're going to discount it even further for those that are on the list. And if you want to reach out to me directly and send me an email, I always answer, always. Wallace on wellness at gmail.com, WALLIS on wellness at gmail.com. And yeah, send me a DM. Like, I am open and available to collaborate, to answer questions. I do coaching, health coaching, and we do a lot of corporate wellness programs. So if you're a corporation and are looking to have innovative, customized, and interesting wellness programs, including the REMS scan, I'm here for all of it. Oh, and our podcast. Make sure you subscribe to the podcast on Spotify, FAMcast, Preventative Health Awareness Movement.
All right, well, that's great. I hope that you get kind of what you ask for there, but your inbox might be quite full. But you're excellent at responding, and we all appreciate that. So on that note, thanks everybody for joining us on episode 11 of Wellness at the Speed of Light podcast. It's been an amazing, amazing pleasure to have Margaret on the show today. And I'm so excited about future collaboration and doing that whole cross-border thing with our Canadian neighbors. I have lots of family in Toronto, so kind of my second home anyway. But on that note, thanks everybody for watching or listening, and we look forward to seeing you on the next episode. And please share this episode far and wide with anyone that you think can benefit from the information that we talked about. On that note, have a wonderful rest of your day, week, month, and year.